think it's always useful for these folks to hear from their constituents and the concerns of their constituents.
But actually, whole way facing to do this, you said popularity is really happen this whole trip. Is that part of it, or is it sort of the case that now we go on financial?
Well, I think a lot of it early on, because obviously I mean, the one thing is obviously he put this forward before any of that polling was done. So, I mean, I think the polling that that they're referring to occurred after he had suggested the proposal. I'm not positive on that, but I think that's true. So, I think quite frankly, you know, a lot of what he was looking at were the numbers. One of the problems that Ohio and all the other states have is that we're going to end up paying more under Obamacare, whether we expand or not. And that's as a state, but get ready for it. You as individuals are going to be paying more for it next year in terms of the premiums that you're going to be paying for your health care plans.
Free for 3 years.
If people don't hang on to another program, if they ain't going to go out and try to find jobs, there's going to be more people on it. It's another end.
Well, and the reason just to fill in the gap, the reason that Ohio is going to be paying more under Obamacare is there's a lot of folks who are currently eligible for Medicaid who don't sign up. Well, despite the fact that the Supreme Court said that it's no longer a mandate, they called it a tax. We can talk about, you know, what kind of contortions you have to get to that conclusion. Nonetheless, a lot of folks are going to end up signing up now in 2014 when the requirement starts to, when you start to hear a drumbeat from the Health and Human Services Department that you're required to have health care now. So a lot of people who are eligible are going to sign up, and they refer to this as the woodworking effect. So essentially the Kasich administration was looking at how much more Ohio is going to be spending under its budget for that, and they were looking to make up some of that budget shortfall. But the problem is, you know, once again, it's not, you're taking short-term money, you know, to give yourself long-term liability, and that's not a good policy choice. Yes, sir.
Yeah. With respect to, I want your comments on this. With respect to the idea that Medicaid isn't really helping the people it's supposed to, what about this administrative industry? Who's behind that, pushing to get it so that they have these jobs, which aren't helping people?
Let's just say that the hospitals made the devil's bargain to get Obamacare, and you know, they had signed on to Obamacare and supported it. That was the insurance industry in order to get the business that would come from the mandate, from the insurance mandate, and they saw this as helping their bottom line. And in exchange for that, they were willing to negotiate cuts in certain federal spending, the disproportionate share hospital or DSH payments. And so now they're kind of freaking out because they're and they're engaging in all kinds of scare tactics. And so they will tell you that, you know, we're going to have to close hospitals if we don't expand because the federal government is not going to be paying its disproportionate share hospital payments at the same rates anymore. And if we have people come in that we don't have insurance, we're not going to be able to provide priority care for them. Well, what they don't tell you is that the federal law actually requires that if the state covers more individuals, the higher your coverage rate, the lower your DSH payments are from the federal government. Which is to say, if we opt into the expansion, we're actually going to get even less money from the federal government for disproportionate share hospitals, less subsidies. What they're worried about will actually be worse in terms of the amount of funds we're getting. But in addition, I'm a little bit unsympathetic to their claims, given that they entered into this party to begin with.
Well, it sounds as if they're trying to countermand the laws of supply and demand. They're going to expand supply and with no real demand being there and take the money.
Well, in terms of that, there definitely is. I don't even know how much they've you know, sort of calculated the supply and demand, but they definitely want the money.
My name's Ron, and please explain more about why somebody on Medicaid would have worse health outcomes than somebody without.
Sure, again, there's a series of studies, if you take a look at the paper, and we go through, we at least reference a number of them. And a lot of it goes to the quality of care received, and quite frankly, if you don't have insurance, you're probably going to be getting charity care. And this actually opens you up, oddly enough, to a better pool, a better potential pool of hospitals, doctors, and physicians, than you would have under Medicaid. That actually seems to be one of the biggest factors that they've been able to isolate, which is, and not only that, but there's a scarcity. You may actually have certain delays in your care because there's a scarcity of doctors and other medical professionals who are willing to accept Medicaid because of the administrative hoops that you have to go through because of the really poor payment structure that's involved. And this actually is something that we haven't talked about as well, which is if you put this many more people on Medicaid, but you don't have an influx of medical providers who are willing to accept that as coverage, then what are you going to have? What you're going to have are shortages in terms of care. You're going to have queues, these individuals waiting in order to actually get treatment. And we've heard about this sort of just as sort of a generalized concern with regard to Obamacare, but in Medicaid, it's already a problem in terms of trying to procure care. It's going to be an even worse problem if you add 500,000 people to the Medicaid rolls.
It becomes obvious that healthcare system is eventually evolved into a single payer or socialized medicine. Are you aware of any studies that indicate at one point in the history of our future, this is going to take place?
I don't know that there's any studies on that, but obviously this, I think the key data point on this is, I think that with this, 1 in 4 Ohioans would end up becoming eligible for Medicaid. So you'd have about a quarter of the state population who would be on a state federally run health insurance program. So that would actually be a significant step in terms of shifting to government run healthcare.
What is the federal poverty rate?
It depends upon whether it's for an individual or not. I mean, I can't remember what the exact number is off the top of my head. I can actually pull that for you. But the interesting thing is, in terms of when we talk about the personal responsibility, we were running the numbers the other day, and what we found is if you're a single individual and you work, given the minimum wage rate in Ohio, if you work 30 hours a week and you're an individual, you're above the federal poverty level. So you don't even have to work full-time minimum wage in order to be above federal poverty level. So once again, this goes back sort of to what I was talking about in terms of individual responsibility. We should be, and once you're at 100% of federal poverty level, you're eligible for subsidies for the federal exchange from 100% to 400%. So if we, as a state, push personal responsibility, help these individuals get to the point where they're earning a decent living, which again, not even working full time in a minimum wage job gets you there, then they're in a situation where they can actually get private coverage on the exchange. They're not in the sort of Medicaid program. So
Taking a page of this is really great information. Thank you. A statement in question, conversation with President Medina, Hospital and Cleveland Clinic, he simply states that socialized medicine equals rational medicine. People, numbers told people just won't work. So you can't understand what this is all about right now. The second issue is, please, I don't mean to simplify this, but I'm back to blocking and tackling the fundamentals of this. In Cleveland, we had the most corrupt government in the world. Everybody in this room, everybody in Ohio knew about it, but nothing's ever done. All of a sudden, the biggest corruption case comes down. Oh, look what they filed. Everybody knew it. My analogy is all clear. The friction that acquired makes sense. I don't understand where Governor Kasich's trying to take it. How do anyone see what he's trying to do? Is there a message what he's trying to do? Because I love the guy. He's a great governor.
Look, let me make a couple of points on this. One, I think that at times it's easy to fall into the trap of taking something like this and focusing on the person rather than the policy. And one of the things that from my days at Heritage Forward, we look at the policy rather than the people, and we'll try and persuade the people. But I think that far too often we end up falling into a trap of attacking the individual or so forth. And I just, in general, whatever the issue is, I would suggest that it's much more effective when you're trying to convince folks down on campus, or when you're trying to convince folks in Washington, when you keep it focused on the policy rather than on the person. And in terms of that, you may be angry at the person for taking that policy position, but I just sort of a general effectiveness in getting things done recommendation. In terms of why he's doing it, I can't speak to it. I can only tell you what he said. And I think that he's going in with the best of intentions. He has talked about being concerned about these individuals who don't have coverage. He's talked about being concerned about the potential budget implications in the short term from the extra costs of Obamacare. On the latter, again, I just don't think that we can be selling Ohio out of a long-term financial situation in order to get a short-term gain. It may help the current numbers, but I think that we can't be short-sighted about that. In terms of helping the individuals, I've already explained to you why it is that it's actually worse for the individuals. And if that's what we're trying to do, I mean, one of the things that I've tried to work with the legislature, if we're concerned about those individuals, then what Ohio should do is Ohio should take ownership of it. Ohio should come up with a program that has personal responsibility requirements, that has cost controls, that we run, that we control, not that where we're taking dictates from the federal government, not where we're potentially left holding the bag for costs in the future. And there's ways we can do it with the current funding streams. We could go ahead and do some reductions to the costs that we're already spending on Medicaid, take those funds and provide very minimal coverage for individuals who otherwise don't have a safety net, but put real teeth requirements in it to either be working, be in job training, be engaged in education, to be shifting you into a position where you're getting off the program. You're gonna have to speak up to go over the
Yeah, I got a big voice. As several of my Marine Corps days, several of us in this room worked pretty hard on getting that constitutional amendment put onto the Ohio Constitution against Obamacare. In fact, so has that amendment been declared unconstitutional, or what? Did we waste our time, I guess is what I'm saying? We just beat our head against the bulkhead and...
Well, no, as I suggested, in this particular case, that doesn't actually address the Medicaid extension.
I understand.
As a matter of law. But again, I think it's a powerful argument. I think it's one that you all should be making, which is that, look, this isn't an opinion poll. This was a vote of the people. We can cite opinion polls all day, but that's not someone going in and pulling the lever. And I think you should you should use that as a powerful talking point of this is how much Ohioans, even in a year in which you had the SB 5 question on the ballot, in which other things were going in a very different direction in the state, Ohioans spoke with a very loud voice about their opposition to Obamacare. And I think that's a very effective point to be making to folks who are seeking to now rely upon an Obamacare or expand Obamacare's influence in the state.
Steve, Josh Van Dell came out opposed to the expansion of Medicare, and he did a pretty good job for a first time around, and I expect him to be our senator sooner than later. But Governor Kasich, I like the guy, but he's reeling from that recall of unions and House Bill 5, and could a scenario come out this position in good faith and have the Senate and House not go along with it and say, I did this. Bill benefit. Because if you look at the play deal the other day, even with the Strongsville teacher strike, they brought up House Bill, Senate Bill 5. And that's pure, Democratic, whatever strike. And I'm glad for my daughter, because she's on the picket line. But he took a hit on this. He didn't handle this like Governor Walker in Wisconsin, who took a different approach. And teachers are happy. 40%, 50% of those teachers are no longer members of the union because they got to pay it out of their pocket. They didn't have a state collecting. So this was a messy policy, and it's going to have that opposition no matter what happens. This reeks of moderation in my views. We don't take a stand like Rand Paul did today. We start to focus on what we're for, not perhaps playing middle of the road political games. It's going to be the same result. We're going to moderate for president of the community.
Yeah, in terms of that, could he benefit politically from this potential choice? Again, I don't know. I this is where I guess my skepticism comes out. I don't see the plain dealer running an editorial in favor of electing John Kasich, even if he gets us across the finish line. I don't see the unions supporting John Kasich even if he got this across the finish line. I mean, maybe it'll have some marginal effect, but I mean, I think those who are particularly ideological are not going to. This isn't necessarily going to sway them. So I'm not entirely sure. Once again, there are those who can sort of weigh in on the political implications probably better than I can, but I don't know that it necessarily will end up redounding to his electoral benefit. Let me just, she hasn't asked one yet.
I just wanted to say, I'm seeing this as our only out on this is having enough people write and complain, not just to Kasich, but to the rest of the officials in Ohio about what we think and little pressure point here, so if they go to
Well,
if
and
you
in
don't say anything, that's like if you don't stand up, if you don't say anything, it's like it's okay.
well, I think in terms of that, if you're looking to have your voices heard on the process, just know, I mean, at this point, the governor has spoken his piece on it. The question is now with the legislature, so they're the ones who have to make the decision. Well, again, there are certain limitations. I can't say vote for or vote against anything, but in terms of when I'm trying to educate folks about the policy, the folks right now who are trying to weigh those questions right now is the House, and then subsequently will be the Senate. So.
How does Batchover feel about it?
Well, I think he's been quoted in the paper as saying that he's got serious concerns about it. So.
It brings up the question, Kasich is not a stupid man by any means, and he's certainly not stupid when it comes to budgets. The man has a history of being a very savvy budget man. He was when he was in the legislature. So if he's this savvy on budget, and he's done a good job otherwise with our deficit in the state of Delaware, why is he doing this? He's not doing it for political gain. He's not doing it to win over the hearts and minds of the Democrats or the union, and certainly not winning over the hearts and minds of the conservatives. He's not. He has to realize all the things you've been saying about the fog that lies at the end of the road. Why is he doing this?
Well, I think, again, I can't speak to it. I actually, and to a certain extent, it's almost, I will say it's almost beside the point. It's just a matter of we want to sort of stop this policy train where it's gone. But I give the man the benefit of the best of intentions. I think part of it is that he's been given bad counsel. Folks in his office had told him, look, we've got to pay for this, this $400 million we're going to be on the hook for very quickly because of Obamacare, new costs from Obamacare. We can help offset that if we do this. So he was looking at that, and they told him we can get out. We can get out if we need to later on. And we've been trying to explain that that's probably, even setting aside the politics, legally that's probably not true. But I think part of it is I think he was given bad counsel, quite frankly. And we're trying to give him some good counsel from the outside.
My name is David. I live here in Medina, and for years I hear squawking and talking and different exposés, so to speak, of people who are dealing with monetary policy, budget concerns, whether it be local all the way through the format of global application. And they all talk about, well, should we spend this money here, should we not? How does the short, long-term play out and all that? And that's all great in the sense of when we look at it, should we invest long-term, short-term or not into a program, into any type of endeavor, whether it be grant, whether it be education system, it doesn't matter. But the one absence that I see in all of it, and it's premised on this, that if you want to control where people go, you have to control the intersections that they travel. Okay? Now, in this, put it in the situations, put it in the light of budgetary and financial concerns.